Thank you, Chair, and good afternoon, everyone. In the presentation, I will share with you the background to the new EU drug strategy and then provide some detail on the action plan on drugs. This is the 9th European strategic document on illicit drugs since 1990. Prior to developing this new strategy, the previous strategy from 2005 to 2012 was subject to an independent evaluation. This evaluation found that the last EU strategy on drugs provided a forum for consensus building and decision making, supported information sharing and mutual learning across the EU on the drugs issue, and promoted a culture of harmonised data collection. The review recommended, among other things, to further promote the development and use of evidence for drug policy and to generate more and better evidence about the effectiveness of policies and action in the drugs field. The Cypriot presidency of the EU led the process for developing and finalising the EU drug strategy. So what is the strategy? Agreed last December at EU ministerial level, the strategy drives collective action on drugs within the EU and by the EU at international level. It promotes coordinated and joint actions by Member States to tackle the drugs phenomenon while not imposing legal obligations to do so. Member States use the strategy and action plan as a framework to develop their own national priorities within the overall EU framework of an integrated, balanced and evidence-based approach to the drugs issue. As we know and have heard over the last few days, the drugs field is constantly changing and open to many influences. At European level, new trends and challenges were taken into account in the development of the strategy and the action plan. These included, first, the growing trend of polydrug use, where people combine the use of illicit drugs and illicit substances, including alcohol and prescribed medicines. Clearly, this presents challenges for diagnostic, treatment and rehabilitation services. Secondly, there is the rapid increase in new psychoactive substances on the market. For example, within the EU, in 2005, 14 new substances were notified, and this had increased to 73 by 2012. The ever-evolving nature of drug markets is a third challenge. Trafficking routes and commodities are diversifying, methods of transport are changing, there is growing localised production of cannabis in the EU, and higher potency cannabis is being cultivated. There's more widespread production of synthetic drugs, and the use of precursors and pre-precursors in the production of illicit drugs is also an important part of this changing picture. So after a process of discussion and negotiation, as I said, led by the Cypriot presidency of the EU, the following 5 objectives were agreed for the new EU drug strategy, and these of course are outlined in the document before you. The first objective is to contribute to a measurable reduction of drug use, drug dependence, and of drug-related health and social risks and harms. The second objective is to contribute to a disruption of the illicit drugs market and a measurable reduction of the availability of illicit drugs. Moving on to the third objective, this is to encourage coordination in the field of drugs at EU and international level. Our fourth objective is to further strengthen dialogue and cooperation between the EU and third countries, international organisations and fora on drugs issues. And lastly, the fifth objective is to contribute to a better understanding of all aspects of the drugs phenomenon and of the impact of interventions to provide a sound evidence base for policies and actions. During the 8-year life of the EU drug strategy, 2 consecutive 4-year action plans will drive its implementation. The first action plan was completed under the Irish presidency of the EU, and this was the first occasion that a member state took this role, previously undertaken by the European Commission. The horizontal drugs group in the EU is the key policy coordination structure, and it was central in facilitating discussion and negotiation between member states and EU institutions on the plan. And importantly, it also facilitated a direct input by the EU Civil Society Forum. So turning to the structure of the action plan, it has 5 policy action areas. One of these is on drug demand reduction, one is on drug supply reduction, and there are 3 cross-cutting themes: policy coordination, international cooperation, and information, research, monitoring and evaluation. And as you see, these are very closely aligned to the EU drug strategy. So the plan comprises targeted actions and details the timetable, responsible parties, indicators and assessment tools for each action. I will highlight for you now a number of objectives and example actions under each section of the action plan. So starting with drug demand reduction, these 3 points summarise the policy priorities for the next 4 years. Prevention, and secondly, delay in the onset of drug use where it arises, enhancing the effectiveness of drug treatment and rehab, including risk and harm reduction, and embedding best practice and quality approaches in drug demand reduction. More specifically, looking at the example actions in drug demand, there are 9 targeted actions under the objective in total, and I now present to you a number of these. The social reintegration and recovery of drug users will get particular attention over the next 4 years. Drug use in prison is also given emphasis. There is a focus on ensuring continuity of care for drug users while in prison and then on their release, with a particular emphasis on avoiding drug overdoses when people conclude their sentences to return to live in the community. The implementation of minimum quality standards at EU level will also receive high-level attention over the next period, and these will apply to prevention measures, risk and harm reduction, and treatment, rehabilitation and social integration measures. So moving on to the second area of the action plan, drug supply reduction. Again, there are 3 priorities here, and I'll read them just to facilitate the interpretation. One is enhancing law enforcement. Second one is strengthening judicial cooperation and legislation. And thirdly, responding effectively to emerging trends in illicit drug activity. So these cover key activities such as countering cross-border trafficking, money laundering, preventing the diversion of precursors and pre-precursors, including strengthened EU legislation in relation to this, and identifying strategic responses to new communication technologies and the production, purchase and distribution of illicit drugs. And I think these echo with some of the discussions we've been having over the last number of days. Again, looking more specifically at example actions under drug supply, in some EU member states there is already national legislation in place to control the availability and distribution of new psychoactive substances. During the period 2013 to 2016, the EU aims to introduce and adopt EU-wide legislative measures to address the emergence, use and rapid spread of new psychoactive substances. Moving to the second point, the action plan is based on evidence-based decision-making, so there will be a renewed focus on strengthening the evidence base by working to standardise and improve data collection related to drug supply with the aim of reaching agreement on key indicators by 2016. And then these indicators are intended to measure success in drug supply reduction. On the third point, EU member states, in accordance with their legal frameworks, will aim to increase availability of alternatives to prison for drug-using offenders. These alternatives will include education, treatment, rehabilitation, aftercare and social integration. So looking at the first cross-cutting theme on coordination, the horizontal drugs group, if you remember, the EU coordination structure on drugs policy, is chaired by the rotating EU presidency and is comprised of EU member states and EU institutions. Under this action plan, the horizontal drugs group will also monitor the implementation of the action plan and ensure resources to fulfil strategy and action plan priorities. The plan also provides for enhanced engagement between the horizontal drugs group and civil society, and between member states and civil society in the development and monitoring of drugs policy. It also explicitly supports the involvement of young people, drug users and clients of drug-related services in the EU and member states and our policy development. So looking outward and moving on to the EU and the wider world, the EU's external role and international cooperation on drugs is captured by this objective to strengthen dialogue and cooperation between the EU and third countries and international organisations on drug issues in a comprehensive and balanced manner. There are 14 priority actions under this objective. I'm not going to tell you about all of them. I've selected 5 areas and I will now share with you a little more detail on these. Under the action plan, emphasis will be given to third countries that incorporate integrated approaches to addressing illicit drug crop cultivation. The EU and member states will continue to support rural development projects and programmes in areas where illicit crop cultivation is taking place or is at risk of taking place, with particular regard to public health, safety and security issues. The EU has a long-standing record of involvement in alternative development, and this action plan recommits to this in line with the EU approach to alternative development and with the United Nations Guiding Principles on Alternative Development, which of course originated here in Lima. 5 elements of the action plan relate to the issue of organised crime and drug trafficking. These include intelligence sharing, strengthening counter-narcotics capacity, working with international partners to tackle the enablers of drug trafficking in areas such as corruption, fragile institutions, governance and financial regulation, strengthening cooperation in asset identification and recovery, and intensifying regional and inter-regional cooperation. So the last aspect of international cooperation reinforces the EU's commitment to regional dialogues, including dialogues with the CELAC, with a view to achieving strengthened cooperation in addressing the drugs phenomenon. The plan also anticipates the UN General Assembly special session on drugs, and the EU will work to speak with one voice in this and other drugs-related international fora. So moving to the 5th area of the action plan, information, research, monitoring and evaluation. This includes an explicit focus on drug monitoring and data collection, and identifying and sharing best practice in drug demand reduction and drug supply reduction, with a particular focus in ensuring adequate investment in research, data collection, monitoring, evaluation and information exchange, further developing our research capacity, and once the research is completed, enhancing the dissemination of the results so that we can share the learning from that research. Some guideline actions in relation to this area. To assist and support the growing number of EU member states who evaluate their national drug strategies, new EU guidelines on evaluation will get priority attention over the next period. The action plan also includes the initiation of new EU-wide research on drug-related community intimidation, its impact on individuals, families and communities, and effective responses to it. New psychoactive substances also feature as a priority action. Key here is the intention to ease access to laboratory reference standards by forensic science laboratories and institutes so that the composition of new substances can be verified and confirmed. And it is also intended to enhance cooperation and information exchange on drug-related forensic science data across the EU. Finally, you see here the key elements of the plan that will generate evidence on how implementation of the plan is progressing and to what extent it is achieving its objectives. This is comprised of 15 overarching indicators, 132 indicators linked to actions with clear data collection and assessment mechanisms operating at EU and member state level. As I mentioned, the horizontal drug group monitoring has a monitoring responsibility. We've committed to an external assessment of the plan in 2016, and this in turn will inform the development of the next action plan between 2017 and 2020. The strategy and action plan reflect a policy approach that is integrated, combining all aspects of drug activities, balanced, aiming to achieve an equal focus on drug demand reduction and drug supply reduction, and evidence-based, using empirical methods to establish the gaps in policy, the effectiveness of policy measures, and using scientific findings to inform policy decision-making. The development of the strategy and action plan was a primary focus of European drug policy over the past 12 months. The coordinated and active implementation of these EU policy commitments is the next important step, so that they make a positive difference to peoples and communities affected by the drugs phenomenon. Thank you for the opportunity to share this European work with you, and I appreciate your attention. Gurmagas.